Hi guys, welcome back to my channel. And today we are with Chatnam again.
Hello guys.
Today we're gonna talk about the NCAS assessment, which is nurses who want to be a nurse here in Canada, especially for the BC, British Columbia state, right? And okay, are you ready?
Yes, I'm ready. It's a kind of assessment for nursing, which you need for every type of assessment, like head to toe, and it's really good for new grads as well. And we are just mention the important things. If we want to talk about it, it's gonna be long, but we just mention the important points.
Yeah, and if we have a chance, we can make another videos for you guys.
Yeah, of course.
Okay.
Okay.
So what the NCAS is? NCAS is about the assessment for the nurse that we need to perform the assessment for the patient. You will get the document something like this. For example, this is mine. It's pretty messed up. You would get the information of the patient, what the patient age, name, date of birth, and the diagnosis of the patient. So you will not know that what kind of the patient you would get, but once you get the information, a piece of paper, then you have to organize your assessment, what you're gonna do with this patient. So for example, about this patient, it would be atrial fibrillation and syncope. Okay, let's go for assessment.
Okay, as Natamon mentioned, you have everything about your patient, like history. But how we are gonna assess the patient? It's like a table which is, just classify the information, and we are gonna talk about that. Like first of all, when you want to start the assessment, you have to introduce yourself. For example, lock the door and do hand hygiene and introduce yourself. For example, you can say, hello, good morning, or good afternoon. My name is Shabnam, and I'm gonna be your registered nurse today. And I'm gonna ask a few questions if it's all right with you. And you have to check the patient's bracelet and ask the patient if the patient is oriented to answer you the name and family name and date of birth, and you have to check with bracelet as well. And also,
can we demonstrate?
Yeah, of course.
Okay, we will show you that how to assess the patient by demonstration.
Yeah. Okay. For example, first of all, knock the door and do hand hygiene. Okay. Hi, Natamon. Good morning. My name is Shabnam, and I'm gonna be your registered nurse today. And I'm going to ask a few questions if it's all right with you.
Okay, sure.
Okay. Can you tell me your first and last name?
Natamon Panmali.
Okay. And can I have your date of birth as well?
5th February 1988.
Okay, great. And can I check your identity bracelet?
Here.
Okay, great. Thank you. Okay, it's like kind of a safety check for the patient and the bracelet, which is really important, and you have to introduce yourself. Okay, the next one is for any check for orientation, because orientation is like person, place, and time. For example, she said her name, Natamon, and it was correct with her bracelet. And Natamon, do you know where you are?
I am in the hospital now.
Hospital. And do you know what time is it?
Maybe afternoon.
Yeah, that's right. And you have to check the orientation as well, because the level of consciousness for the patient is really important for us. Okay, the next one is general appearance. For example, if your patient is cooperative and talking to you and answer your question properly, not saying any word which is not proper, or any sign of anxious or worried about anything, and you can check the skin and hygiene of the patient, or check the nails, check the hairs, and the position of the patient. For example, you can ask the patient, Natamon, are you comfortable in this position right now, or would you like to elevate your bed a little bit?
I feel not comfortable.
Okay, would you like to change your position a little bit?
Yeah, can you help me with that?
Yeah, sure, of course. And make sure that your patient is comfortable, because
Always.
because you're going to talk with your patient for a period of time, and it's good that your patient feels comfortable on that time. Okay, and the next one is checking for food and fluids, your patient's appetite, and is your patient able to eat, or is there any fluid restriction? You have to check all of them. And also, if it's any restriction, for example, if the patient is NPO or any fluid restriction, it's kind of precaution on her or his room, and you can check all the precautions when you ask the question. Okay, the next one is gonna be site to source, which is everything that your patient, your patient has, like IV line, Foley catheter, NG tube, or oxygen, whatever which is related to your patient, you have to check site to source. For example, if it's IV here, you have to check the site, like any redness or warm swelling or any pain here, you have to ask the patient, or you can check by yourself. And site to source, it means you have to check the tube, if it's
the IV bag.
Yeah, exactly. If it's any leakage, or if it's any anything, you have to check site to source. For example, for Foley catheter, you have to check the genital area completely. If it's any leakage, discharge, or everything is okay, to source, it means that check the Foley catheter completely.
Especially for the type of IV fluid. Is it the correct with order, for example, normal saline, but if it hang with other type of fluid, like 5% half tank, something like that, you should check it that its sort is correct with the order or not.
Yes, exactly. And after that, as I've mentioned, you have to check the patient for skin. If you find any wound, and if it has any discharge, or patient has any dressing, you have to check them completely. And as you know, we have two types of data, like subjective data and objective data. Subjective data is whatever the patient present. For example, I have pain, it's pain on my shoulder, chest pain, shortness of breath, everything the patient says. And for objective data, it's whatever the nurse observe or obtain from the patient. And okay, for subjective data, can you example for subjective data, like
you can ask the patient, how you feeling today, for example. How you feeling, how was your sleeping last night, did you sleep well, or do you have any cough, shortness of breath, or how do you feel? Anything you can ask from the patient. Or even for example, patient admit with their syncope. How about your syncope today? Do you still have dizziness? Or how you feel if I can assist you to walk? Do you want? How can you feel about that? Something like that.
Yeah, exactly. For example, if I ask the Natamon, are you in pain today? Do you have any pain?
No, I'm good.
No. Or if you say yes, we have to check the pain level from 0 to 10. And also we can check from head to toe again for any thing that the patient present head to toe, and we have to just record them. For objective data, it's again like subjective data. We have to consider head to toe, like head and neck, chest, abdomen, arms and legs, and back. We have to check all of them separately, and it's You need to know everything about the physical examination. It's not necessarily to do everything for your patient head to toe, because you have to focus on the patient's problem, not to do the physical examination completely. But if your patient has a heart problem or like CHF or AF, you have to focus on cardiovascular system. Yeah. And for next
even
one,
including vital sign.
Yeah, exactly.
Objective data.
Yeah, exactly. Vital signs, because you obtain from the patient, is kind of objective data. Okay, and another thing, if we wanna to brief our video, like if the patient, when you do your assessment completely and record all the problem, you have to, it's kind of close your close your conversation. And you can say, okay, I gathered all information which I needed, and would you like to add anything? Are you comfortable, or do you have any question for me? By this question you can close your conversation. And before you go, it's really important to put the patient's belongings, like glasses if they need, magazine, or remote control or anything that your patient need, because if they are in a situation that they are not able to move or they don't have ability to move, if they want something, it could be kind of risk for their safety. So you can put everything what they want, and by this you make the patient safe. Yeah.
Okay, I think this video just about brief or the assessment we have to do, but if we have a chance, next video we can demonstrate to you that how we assess the patient on the each system, something like that.
Yeah, exactly. We can focus on the patient's problem and demonstrate you how to assess the patients and get the necessary information. Okay, hope you enjoyed the video, and if you like the video,
please subscribe and press the like button.
Yeah, thank you guys.
Okay, see you in next video. Bye.